Let me button this. Here I am in the dark, broadcasting live from Tarpon Springs, Florida, in the middle of a hurricane. I figured I'd try to do this in case the power went out, but so far so good. We haven't really gotten too bad. 40, 50 mile an hour winds, and we've had, I think, 7 inches of rain so far, but it's been okay. We're going to survive, and God willing, be here for another day. But today, since I had time, since this was golf day, and obviously with a hurricane coming through, we didn't get a chance to play golf. So I had plenty of time to delve into the New England Journal of Medicine, and I wish I didn't, because as I said in my little opening stream, it's time to get aggravated. And I really get sick and tired of the bias which is in medicine. You know, we heard all the bias within the political world, but I'm just going to go through this quickly. This isn't going to be a long, drawn-out affair, but we're going to talk a little bit about what has been reported to your doctors today, why I think it's so crazy, and maybe you'll agree with me. Number one story, antibody treatment authorized for COVID-19. Now, why do I say this is crazy? It says the FDA has issued an emergency authorization for monoclonal antibody treatment for mild to moderate COVID-19 because, a month and a half, 2 months ago, when Trump came down with this and they used that therapy on him, we heard every negative thing in the world. It's not proven, it didn't work, it's not going to do anything, it's not going to do this, we're not going to do that. Now it's approved by the FDA. So Trump was a guinea pig for it. Again, note the bias in the media, note the bias in the FDA. What it took for them to finally say, hey, this might work. But God help us if Trump tried it. Story number two, mobility patterns and infections. These are from Dr. Fauci on down, the idiots, I'll call them idiots, that are making the guideposts, and this includes Joe Biden, that is going to predicate when, where, and how you're able to live over the next year. Reducing maximum occupancy at certain public venues. It's at 25% to maybe 50% in most places. This is saying we got to go bigger than that. If we reduce occupancy to do more to limit SARS coronavirus transmission than just reducing mobility overall. Researchers conclude. The researchers use cell phone data. Bet you didn't know that. They've been monitoring your cell phone. Use cell phone data to track people's movements to over 550,000 different locations. Yep, Big Brother's watching you, folks. Restaurants, religious venues. Notice they put religious venues number 2. 10 large U.S. metropolitan areas between March and May. They then incorporated this data with a SARS-2 transmission model. Overall, they found that a minority of locations accounted for the majority of predicted infections. And they suggested that reopening plans emphasize restricting capacity at these super spreader locations. Guess where the super spreader locations were? Those people protesting in the streets? No. Churches. In addition, they found that lower income people are more likely to become infected because they were, listen to this, nonsense. They were less able to reduce their mobility. Why? What made them any less able to not mobilize? Researchers urged policymakers like Joe Biden to advocate for emergency food distribution centers to help keep the high-risk stores less crowded. Grocery stores were called super centers. So they want to impede your capability of going to the grocery store. They want to impede you from going to church. Now this one. For those of you that like fur, my wife happens to. We waste our time on these things. Mink to human transmission. A study in Science proves evidence that minks, M-I-N-K-S, minks, the little rodents that are grown to make furs, can transmit SARS coronavirus to humans. Researchers studied outbreaks among minks in 16 farms in the Netherlands. Of 97 farm contacts, farm residents, employees underwent serology. Over two-thirds has evidence of SARS infection. Made it likely that the minks were the source of the infection. Notice when this thing first started, we talked about bats. Now we're into minks. Now, I'm going to get away from coronavirus and get some more fired up. I will tell you this, that over the last 10 years, probably more studies came out basically saying, since medicine wanted to put lipid-lowering therapies, i.e. statins, on everybody, they found over time virtually no benefit whatsoever for those over the age of 70. None. In talking to most physician friends of mine, if you came in and you were over the age of 70, they didn't even look at your cholesterol numbers because it made no difference. It did not give you any longevity. But I guess sales are down now. So we're going to start again. Researchers in Denmark studied 90,000 adults who at baseline did not have atherosclerotic cardiovascular disease or diabetes and were not taking statins. During 8 years of follow-up, some 1,500, and it goes through, and basically said the meta-analysis of randomized trials found that, yes, indeed, we should change our course and put everybody on statin drugs. And the beat goes on. Story number 4. This one really got me fired. It was the whole reason I'm sitting here at 8 o'clock on Wednesday night in the middle of a hurricane doing a show. Among adults age 70 and older with no major comorbidities, healthy people, treatment with vitamin D, fish oil, and strength training does not seem to improve a range of physical outcomes. If you are an exercise physiologist, if you work in a gym, if you exercise, if you've believed for decades that there was such a huge benefit to working out, if you've been taking fish oil in the decades and decades of information that came out that said they improve cognitive outcomes, if you believe that vitamin D could protect you against a whole myriad of different things, then you're going to find that Dr. Thomas Schwank of the New England Journal of Medicine took his takes on this and said, didn't do anything. Roughly 2,150 community-dwelling older adults in Europe were randomized to receive. Now, here's the big mistake, and this is what the learning lesson for you. They gave these people 2,000 IUs a day of vitamin D, and I said that is a pediatric dose. They gave them 1 gram of omega-3s. Again, a pediatric dose in some unknown strength training exercise program, alone or in various combinations. After 3 years of working out, and saw no significant differences in physicality. Can I say bull on the air? Can I say they should be ashamed to put this kind of garbage in the news? After 3 years, no significant differences between the interventions and controls of any outcome studied. No changes in blood pressure, no changes in physicality, no changes in brain and memory. On November 9th, it was an astounding day for research on prevention of infectious disease, really unprecedented, because it looks like we may have a COVID vaccine. Lastly, the U.S. Preventative Services Task Force. This was a group formed by Obamacare that was lovingly called the Death Squad or the Death Board. That jokingly they said, I don't know how jokingly it was, that this was the board that would decide how long you would live. U.S. Preventative Service Task Force again concluded that the evidence is insufficient to recommend against checking blood pressure in asymptomatic children or adolescents. Takes 5 seconds, well, let's say 15 seconds with a blood pressure cuff to check and maybe see that your slightly overweight child may have hypertension. This thing goes on to say it doesn't address the real questions, including how can clinicians properly measure blood pressure in children? You put a cuff on their arm, you idiots. What interventions can reduce or prevent these potentially negative consequences? Get them to lose weight, get them to exercise, get off their duffs. But you wouldn't want to tell them that, would you, dear doctor? Because you're an idiot as well. The American Academy of Pediatrics, what a group of whack jobs that is. And again, I'm sorry, but that's got me fired up in the middle of a hurricane. I should go outside and just cool down, huh? Anyway, you want to reach me? You argue with me? You want to take me to task on any of those? You want to agree with me? Give me a call, 678-228-8900, 678-228-8900. For those of you that maybe just found us on YouTube, my name is Len Bransowitz. I am the doctor and staff here, naturopathic medical doctor, pharmacist, board certified in clinical nutrition, and a pharmacy doctorate in homeopathy. Whatever your needs are, we could become part of your healthcare team. Just give us a call, 678-228-8900. You want to know more about us? Go to our website, thenutritionshop.net, T-H-E, thenutritionshop, S-H-O-P-P-E.net. Next time, there'll be some sunshine, I hope. God bless you, folks. See you back here tomorrow. Take care.